Good evening, everybody. Welcome to another special panel here at Bethany Baptist Church, the Transformation Church of New Jersey. We're so glad that you can join us this evening as we talk about a very important topic, which is the COVID vaccine. We want to share information about the vaccine, answer some of your questions, ease some of your concerns. Actually, before we got here, I just had a conversation with somebody that is on the fence about the vaccine, and just be able to share information with you all. So please do us a favor if you can. Please share if you can, as we always ask. Tag somebody, get somebody on as we share this very important information about COVID as well as the vaccine. And again, please do us a favor and share as much as you can. And we see a lot of people are coming on. And as we're coming on, of course, I am Pastor Nick in the middle, Reverend Richard White, Pastor Rich White, of course, Bishop David G. Evans. And then we're so glad to have Dr. Anna Lopez and Dr. Cindy Ho from Jefferson Hospital. And as people are coming on, if you two are okay, Dr. Lopez, will start with you. You can introduce yourself. What do you do? What is your primary field? Whatever you want to share with the people, then Dr. Ho will go right to you.
Sure. Thank you. So first, thanks so much for the opportunity to be with you this evening. I'm sure there's lots of things that folks can be doing on a Thursday evening. So appreciate you joining and speaking with us about COVID vaccination. I'm a medical oncologist, so I'm a cancer doctor. And my area of interest has really been risk reduction. That's what I do research on, and I treat folks with cancer, primarily women with breast cancer. But really the focus is risk reduction, prevention, and to that end, this conversation is very much in line with that. Thank you. Dr. Ho.
Hi, thanks everybody. Thank you for joining today. And I'll tell you a little bit about myself, and I'll give a little personal story too. So I'm an infectious disease doctor, and that, obviously that's been big news during this time, but my passion related to this is to prevent infection. That's one of my roles in the hospital. And when I think of preventing infection, I even though my main place of work is in the hospital, I do things like in the office, and I try to do outreach to community, but sometimes I get focused in the hospital. So thank you for giving us the opportunity today. So, during kind of the whole time, I've seen the sickest of the sick, kind of the people that you see on the news, and like right there at the bedside. And back in the beginning, we didn't really have too much. So you just, certainly there was no vaccine, right? So I certainly think of other people. So you just go old school, just put on all the stuff, the PPE, and you just go in there and you take care of the patients. And on a personal note, like many of you, COVID has impacted you in some fashion, or maybe you know of somebody. And my uncle didn't make it at the beginning of the COVID pandemic. So I certainly am very invested in preventing this for anyone else that I possibly can, because I've seen it for real, personally and professionally. So thanks so much for joining today.
Sure. No, thank you. So if you have any questions, please put them in the comments section. Maya is going to keep the tab on them and give them to us as we go. Before we get into the topics of concern, Bishop, would you like to share, the church's stance on the vaccine, why it's important to do panels like this and have discussions?
I want to welcome everyone again. I believe that as one of the religious occupiers of the forefront in the state, and also known nationally, that our example will be probably one of the best encouragements we can give to people, that the vaccine is actually something you want to do, something you want to get. All of the people on this panel have been vaccinated. We came away, some tired, some with a headache, but still we were inoculated. So what we've been trying to do by example is let people know that this thing is safe. Of course, with any kind of medicine, any kind of pharmaceutical, there will be some people that have a reaction to it that's severe, but we believe, based on our own lives, that everyone that we can encourage to get the vaccine should get it. And I think that in the environment that we're in, that encouragement coming from us being an international community, a national and international community, and a multiracial community, we are at the forefront of encouraging people to get the vaccine. And we're getting calls now. I believe 2 weeks ago, we got a call from someone connected to the state. We were able to arrange almost 800 vaccines in 2 days. So it was a yeoman's job that one of our deacons, Roy Trader, led, and we were able to do some great work in a matter of 2 days. 800 people vaccinated. So we were pretty encouraged by that, and we're trying to set that standard.
Absolutely. That's good. So we'll start with the first question. And I know, Pastor Rich, you work in the biotech field, correct? From that side.
Yeah, I've been in the pharmaceutical food nutrition industry for about 25 years now.
So I'll throw this to the doctors, and Rich, if you want to jump in on this, the testing process. There are people who are wondering about how quick the vaccine got out. They say vaccines usually take about 5 to 10 years. This happened in about a year and some change, correct? What are your thoughts? If somebody comes and asks you that question, how would you respond about the testing process?
Well, as far as the vaccines, there was a lot of transparency. So though this happened in China, they rushed to kind of do sequencing. And then a lot of companies were very invested in saving lives. And so we had the technology there for many years. And it just didn't take for certain things that they were working on before, as well as this particular kind, because it's like one particular type of coronavirus. And there are a lot of efforts on in this day and time. You have a lot of social media and just the power of the people to volunteer to be a part of research clinical trials, because this is how the rest of us learn, that somebody had to be tested on it as a volunteer, really. It's for the greater good. And so there are many factors that made it seem like it was kind of the warp speed frame that you've heard, but actually it was quite timely and so great that we had this at our disposal. Dr. Lopez, would you like to add anything else?
Yeah, I think just for people to remember that it did happen very quickly, but it was also a collaborative effort all over the world. And as I understand that the number of people that participated in the trials is as good as the number of any trial that has been done around vaccination research.
Okay.
Do you think that the swiftness of the spread was part of the reason that scientists around the world agreed we need to get something to people as quickly as possible? And I also think, I'm not sure that, I'm 69 years old. I can't remember another time when there was such a worldwide agreement, or when the public was as aware of a vaccine being developed than it has been for this one.
Yeah, it certainly hasn't occurred in my lifetime, and as an infectious disease doctor, this is like kind of an aha kind of year that hopefully we'll only ever experience once in our careers and everything. Yeah. But certainly everybody was, as they say, all in, just for all these different, different entities and globally as well.
Yeah.
And in some of the industries, Dr. Ho and Dr. Lopez, because of how much work has been done in vaccines over time, did that allow us to get to this one a lot quicker? At least that's some of the information I've been given, because we've done such vast amount of work with vaccines in general, that it allowed this one to be a little bit more fast tracked than if it would have happened 30 years ago.
Oh, for sure. Just with the technology, for example, definitely we've learned a lot, and it's just kind of just happened to be that this opportunity came across us. So exactly, Reverend. Absolutely.
Good. Yeah, I heard another doctor say that they did the same thing, just quicker with more people. The test trials were, I don't use the word quicker in a negative way, but they were able to accelerate the process due to the new technology that's out now. I think, so with that in mind, I know a lot of people in the minority community are worried about healthcare and its role in the minority community, especially in the African-American community. It hasn't been, in some cases, the best. And we're still seeing some of that now. People like to reference Tuskegee, and I think this is a completely different situation in Tuskegee because those doctors had the cure and chose not to give it to the men at Tuskegee. They didn't give them the disease. The men had it already. They just chose not to give it to them because they wanted to see the long-term results, correct? So I'm not sure if any of you deal with that, but we did talk that especially in the African-American community, COVID has hit our community worse than anyone else. And I would love for you all to be able to speak on that particular topic.
Sure. I think that's a really important topic. As a Latina, I know friends who have, as Dr. Howe mentioned, I think this has been so broad that we all know people who unfortunately have died, have been severely ill. But when we just look at the numbers, this is hitting our communities. And we're the people that are dying. So with that, just so important to try to preserve people's health. I do think that historically, there's equity is not, equity should be present in all aspects of healthcare. It is not. I think that's something that we're both very committed to and hold very much as part and parcel of what we do. So it's true. Having skepticism, having doubt, believe it. But on the other hand, I think the five of us, as we were talking, we've all been vaccinated. And to really trust in the science so that you can stay as healthy as possible.
I think one of the key things to in this process is that there have been some aspects of social media that have been antagonistic, that they've been throwing out there things that are myths, and it's very good to have a forum like this so we can kind of hash it out, so to speak.
Yeah.
But history carries a lot of weight, so and so it's understandable that many times one looks at history and what was felt to be experimentation and so forth, but this is not an experiment. This is about preventing death, saving lives, because the vaccines have shown to do that. And I'm just so grateful that they exist. And I'm at the same time, I'm super motivated to get more people to realize the power of what we have now at no other point in our life. And I think it's unfair to equate it this way. But I'll give you an example. Like each of us, like I'm sure we've known Dr. Lopez, especially, like a lot of people with cancer and stuff. And again, it's not quite the same comparison, right? But just think in your life for a second, like somebody that that didn't make it from cancer, and you would have done anything to get them back, right? So I think of that many times in my role for infection prevention. Like, is there anything I can do to prevent infection? And yes, some of the things that we know that are complements to the vaccine, like the hand hygiene, the mask wear, and so forth. But yeah, we have tools now, which is so incredible. So we really need to share the world that we're here to prevent this devastating disease from happening, really.
Sure.
And I did just want to share, while you were, when you asked the question, I remembered that there have been breakdowns of the participants in the trials by race, ethnicity. And as you may know, that in general, having equitable representation in clinical trials by race ethnicity is not so easy, or doesn't, I mean, I shouldn't say that, doesn't often happen, but that the numbers are pretty close. And I can send this to you, Pastor, and you could share it with folks. It's not a one-to-one match, but for example, for people of African descent, it does say the population 12%, and for both the Pfizer and Moderna, there were about 10% of the participants. So it's pretty close.
And that's great to hear. We were on a panel earlier this year where Dr. Wayne Frederick from Howard University and Dr. Leon McDougall, the president of the National Medical Association, talked to us about how it was a little delayed getting those other cultures into the testing, but they were able to do it and it's worked well. And the big deal, which I think both you and Dr. Howe can talk about, Dr. Lopez, is that the ACE inhibitors for non-Caucasian people is so different than that for whether it's black African American or Hispanic or Asian American. That's why it's so important to have those other groups within these phase trials.
Absolutely, and I'm so glad you got to meet Dr. Frederick and Dr. McDougall. Yeah. They're great. I know Dr. McDougall a little bit better, and that's great.
They're both great guys. Bishop put me in touch with them, and it was a great conversation. And it was good information to have because of what Pastor Nick was saying earlier about getting the information out to the church in our community which we serve.
Yes, but I think your point's really important, that in order to make scientific conclusions, the people that are going to be receiving the medicine need to be a part of those trials.
Absolutely. Makes sense. Yeah. Now, is there any difference between, could you explain the difference between the three major vaccines in America? I don't think the the names just left me.
AstraZeneca.
That's not over here in the States yet, is it?
You're not old enough to be experiencing that, Nick.
I know. I saw it and it was like, it just went right away.
Yeah. As my grandmother would say, you're not far enough down the road.
It was right there, just left these kids. But Moderna, Pfizer, and Johnson & Johnson. Are there any major distinctions between the three of those? Is a 2-shot better for those who are older versus the 1-shot being best for the younger crowd? What is your advice on that? It may be a little difficult because Johnson & Johnson is more the newer one, but I would love to hear your answer on that.
Yeah, I think there are some things that are a little bit different about them. So as you know, some of them are 2 shots, like the Pfizer and the Moderna, and then the last one that was approved is the 1-shot. So I think, basically the CDC says that whatever you can get a hold of, please just get it right away, because it's about access and what you can get your hands on. Now, I will say from an equity standpoint, if someone cannot travel somewhere, I see the potential benefit that if there's any entity that can go to that person's house because they're not able to, they're disabled. And in that case, I see a potential role that it might be easier if J&J is able to do that 1-shot, and then that particular person is covered. But they're all efficacious. But from an equity standpoint, that's just kind of my thought on the 1-shot. Sure. People who don't have the ability to travel. They do have a little bit of differences as far as coverage for those kind of variants that you've heard about. People hear about, the one from the UK or the one from South Africa. So I believe that the Pfizer vaccine, that's the 2-shot, it's fairly good at the UK and not as much for the South African. And then for the Moderna and the J&J, they're thought to be okay for both the UK variant and also the South African one. And obviously, if you have 2 shots, there's 2 times that you could hurt versus the 1-shot. Well, there's just one kind of needle itself per se.
Sure.
Dr. Lopez, sorry, Dr. Lopez, would you like to add? Or
I think that was perfect answer. I don't think I have anything to add.
Is it safe to say that even though you've been immunized, that you still need to maintain protocols? Because it doesn't feel like, and perhaps both of you can correct me on this, it doesn't feel like enough has been, time has passed and study of the variants, and they're constantly developing to know what's going to, what you can still catch.
Yep.
Yeah, and I think the impact is you probably won't end up in the hospital and you probably won't die, but there's not enough information on the variants to really make a solid statement.
Yeah, Bishop, you're totally right. The way I think of it is it's all about prevention, right? What are all the things you know to prevent? There's the vaccine, and then there's the old school, the wearing the masks, hand hygiene, the social distancing, all of that. That's all throughout this process. Just remember, before we had the vaccine, that's all I had to protect myself from bringing anything home. So yes, it works because I totally was in there like all the time. And we definitely need to still emphasize that. What is also not as known yet is if your body is weak, and by weakness, I mean if you have cancer, if your immune system is compromised, but I would also put in there if you're old, and I really don't think of old as over 65, but some people do.
Thank you.
Dr. Howe is making it real.
Where do I send the check? Where do I send the check?
My point being, though, is that as we get more mature, I'll say, rather than more older, your immune system does take a hit, and it's not the same as if you're, I want to say, less mature or younger. And so same thing, like how we don't quite know how long the protection will last. And for those people who are on medications because they need to, because they have a transplant, because they're actively undergoing chemo, maybe it won't, maybe they have to take additional precautions just like everybody else. And it's all about protecting ourselves.
I think some people believe that I've been immunized so I can widen my circle. And I think the conservative approach makes the best scientific sense. Keep your circle small until we have more information, because if you have a compromised immune system, or even if you don't, you don't know which one of the variants you can pick up, and they seem to be developing all the time.
Mm-hmm.
Like they say New York has one now. Is that true?
It is true. And, it's just, you can imagine that the virus is smarter than any one of us. And I almost feel that sometimes it's not talked about as much, because then people be like, oh, you're from the US and so forth. But definitely, we don't have enough people who've either had it naturally or who have been immunized. So in the meantime, the virus is smart. They're like, aha, I'm going to build some resistance here. And you have to keep your circles tight. So if your circle is all vaccinated, great, but when you start to slip and slide and you go beyond the things that then that's a chance that you could expose either yourself or bring something back to the people that you know. And that's a very, very sneaky thing about this virus.
Even though you've been vaccinated.
Yes. You have to be safe. What I'm reminded of, so part of my training was really during the early part of the AIDS epidemic. And we really had the whole concept about universal precautions. And I think that that's right. You either are always assuming I have it and I don't want to give it to anyone, or the person I'm with has it and I don't want to get it. So to really have that thinking, so that we're always cautious, because we want to prevent variants. And the only way that those mutations happen is if the virus is proliferating. So if the virus is dividing, that's when those mutations can happen. And that's when those dangerous variants can emerge.
I was reading about that, the flu pandemic of 1918. And how it came to an end was because the inability for it to continue to travel and make those variations. And I think that took almost 3 years for that pandemic to end, if I'm correct. I think it was started like the end of 1918, ended in 1921. But you're right. I read something that the states where people are getting vaccinated the most, the COVID rates are going higher because we're assuming people, because they are vaccinated, they can go out to.
Yeah, they're letting down their guard.
Yeah.
And expanding their circles, and they're going into situations, I believe, that are not their normal situations, and exposing themselves, and then bringing it back, and maybe asymptomatic, but not necessarily not carrying it.
Yeah. And so I was reading something the other day that even people who had mild COVID, they're discovering months later they have long-term side effects like memory issues.
Yeah.
It was just a cold to them when they had it, but something popped up later on, ringing in their ears and some other things. So everybody should stay cautious. Now, we have a bunch of questions. Bishop, I would love for you to address something. Somebody brought up a faith comment in the comments, and please talk about how faith and science are supposed to go together.
Yeah. What was the comment?
The comment was, I believe God, we can trust in God to heal us if we get sick or protect us from the virus, and why do we need the vaccine kind of thing. It was earlier in the chat.
I think the obvious biblical illustration is that even though the Lord Jesus was capable of healing any sickness or any condition, whether short-term or long-term, he happened to carry a physician with him among his comrades that we know as the disciples. So there was a respect for medicine, science, if you will, by Jesus Christ in his own, if I can call it, not irreverently, crew, as they traveled, doing what he did, which was ministry. Secondarily, we're in a season now where wisdom is being viewed as a lack of faith. Jesus did not heal every disease. The Bible tells us that. He brought a physician with him to address those issues. So there's a marriage between science and faith, which is absolutely logical to me. And biblical wisdom, there are things you pray about, and there are things you go to the doctor about. And the problem now is you can't convince me that out of 500,000 people who passed away, none of them had faith. As a matter of fact, many of my comrades around the country have died from COVID because they insisted on exercising what they thought was faith, but actually it was rebellion disguised as faith. And they paid for their lives with it. So the fatalities, the absolute homicidal nature of COVID demands some wisdom, but that does not mean you don't have faith. If I can say it that way.
Absolutely. Because a lot of Christians, like you said, are passing away from it.
Well,
and
yeah,
it's
and there's if you feel that way, then you jump in front of a train and say, I believe God. Well, you'll be seeing him shortly.
Yeah, literally.
So it's just sometimes we become unwise.
Yeah.
And start to believe that the medicine that God put here on earth, he didn't put it here for us. And it's nonsensical. It's nonsensical.
Yeah.
We're people of great faith. We've seen tremendous miracles over the last 30 years. But, I still go get what I'm supposed to get every year, trusting God and also practicing wisdom. It's not a lack of faith.
Yep.
Yeah.
I heard somebody say we don't know we don't know everything that's an aspirin. We just know when our head hurts. You take some aspirin.
You take it.
So,
and we've seen plenty of people that have been sick that we love that had plenty of faith, And it wasn't because they weren't going to the doctors. You know, this thing, as Bishop has told me, the rain falls on the just and the unjust. This thing is no respecter of persons.
No.
COVID doesn't care who you are.
No. And I'm convinced it can't count. I'm convinced it doesn't know the difference between 3 feet and 6 feet. I'm convinced. The only thing it didn't fail was multiplication, but everything else it failed. You know, so it's just we need to get a grip.
Absolutely.
Yeah.
So first question, is the vaccine safe for individuals with severe allergic reactions?
I wonder what those reactions were.
I know when I went, they asked, was I allergic to anything? Because they wanted to make sure I didn't go into anaphylaxis. And somebody I talked to, they said somebody didn't recommend they should get it because they have to have an EpiPen. So they weren't sure. So I would love the doctors to be able to, chime in on that.
Yeah, so, definitely when people have severe allergies, severe medical conditions, they said always talk with your physician. But even for people who've had allergies, they've been able to take the vaccine. Of course, if you had a severe allergic reaction to shot 1 of 2, then no. But there's a lot of what we call observation of an individual after they get a shot for anywhere from 15 minutes to 30 minutes, just in case somebody has a history of allergies. And people are basically prepared to just monitor you. And it feels very safe, honestly, to be watched after your shot.
Can you talk a little bit about, we've had a few questions on the side effects. Like after I had my second Pfizer shot, I was fine, but then like 15 hours later, I was really tired. I was really tired. It didn't last for long, but I was just tired. I know other people that have had fevers. I know folks that have had some small allergic reaction, headaches. Can you talk about the side effects and what folks should or should not be concerned about, or when they should or should not, have to call for some medical assistance, if at all?
Sure. Really important, as Dr. Howe just mentioned, is to talk with your healthcare team with any questions. And, it's very common for people to have some symptoms, kind of like what we all do after a flu vaccine. So the arm might feel a little achy. You might feel a little under the weather, maybe kind of achy. Maybe a little fever even. Some people have some achiness just kind of all over, maybe feel like not as much of an appetite. But what this is all about is that your body has identified that this is something that's, it's developing an immune response. This is not something normal in my body. And your body is doing what is normal, which is to develop an immune response. And so I'm like the biggest fan of the human body. It's just like a wonder. And then the reason you get the symptoms a little bit more the second time around is because your body now says, whoa, I really see it. And they go for it. So it's kind of like that recognition response. Now, there are some people that have maybe more fatigue. I know that after my second vaccine, I was a little bit more tired. But think of it, it's your body working. Your body's mounting an immune response. But certainly if there's symptoms that that you think, this is a little severe, talk with your doctor, talk with your healthcare team so that they can help you sort it out. Dr. Howe, did you have anything to add?
Yeah, I mean, people can have all sorts of symptoms. Those are the common ones that we talked about. I think, Reverend, you asked like when we will become more concerned. So one very distinct possibility is, let's say if I let up my guard and I didn't wear a mask, and like a week before I'm kind of out partying or something, and Miami Beach or something, and then I go back home and I get my first shot. Okay, now there I could get COVID, the disease, because I got exposed in Miami And so if these fevers are persistent, you're short of breath, because the COVID vaccine, if you get a swab, the COVID vaccine doesn't make that turn positive. That means you have the disease. So there's a certain point in time where, the concern is if you have the disease and not side effects. So it's all kind of exposure and time and what you did, and you're like kind of what I call slippage, but really bad slippage. So.
Which lends to it, if I just could add one other, that folks that have had, I know folks that get allergy shots every week, and so they said, okay, because you get allergy shot, you need to wait a week after or 10 days after you get your allergy shot before you get the vaccine. Or folks that have had COVID, they need to wait a certain amount of time before they get the vaccine. Can you tell us how long that has to be?
Yeah, so the answer has kind of varied over time. So usually the CDC has a kind of a living, breathing document because, 1 week you'll check on it and there's like a day, there's a slight change and so forth. But the latest is basically if you had COVID and you want to get the vaccine, basically you could still give your COVID to other people. So do not show up when you're still having symptoms. You're contagious to other people. So the normal amount of time that you would quarantine, you should not be getting your vaccine. But these days it's a closer amount of time from roughly, say, 10 days, because that might be when you're out of quarantine, kind of depending on how your illness might go longer or shorter, because, if you're coughing, everybody looks at you, right? So, if you have had COVID and certain kinds of therapy, such as two specific ones, there's the convalescent plasma and the monoclonal antibody. It's felt that these things give protection over 90 days. And so they say don't get your COVID shot until after if you've had those two specific therapies. So, but as I said, sometimes things change, but I believe that's the latest.
Okay, thank you.
And your comment about folks that may have allergies or immunocompromised, we are certainly still, as Dr. Howe mentioned, we're learning. But definitely for patients who have a history of cancer and who are, so overall, more vulnerable group for infection. But people who are on chemotherapy, because, chemotherapy often suppresses the immune system, really need to talk with their doctor about the timing of the vaccination. So we're all supportive about the vaccination, but the timing is really important. And I know that that's been difficult for people. So, because sometimes you call or you get online and it's not like you have choices. You kind of get the appointment you can. So we've certainly been working with patients to say, okay, that's your time for your vaccine. We're going to modify the time of your treatment so that you can get the maximum benefit from your vaccine.
Do you mind if we go rapid fire so we can get some of these questions in? Is that okay? All right. The first one was talking about the long-term side effects of the vaccine. Do we know, will there be any autoimmune issues or anything? But of course, we're not sure because we don't know the long-term effects, but that's a big concern. What are the long-term effects of the virus? So people are afraid, people are afraid to take it because of that reason.
It looks like the question is long-term effects of the vaccine itself. Well,
yes.
Ingredients, yeah.
Yeah, the ingredients.
They are doing clinical studies so that, because the vaccine is new, right? So they have to follow these people out. I'm not aware so far of any long-term effects from getting the vaccine itself. They're studying people of whether they'll have unusual symptoms or whatnot. There is a kind of a vaccine application that the CDC and others are looking at to kind of record what kind of symptoms are you getting. So at the current juncture, I'm not aware of any that are kind of long lasting, not like kind of when you get COVID and then you get symptoms like months later. At least I personally haven't heard of so far.
Yeah.
Just to bring a little perspective, kind of circling back around to, this is probably the most intense global interest in a vaccine in the last 70, 80, 90 years. When the traditional flu vaccine, do you hear questions about side effects from that or long-term effects? And if not, have we become used to the flu vaccine? So now we realize that most people don't become ill when they take it, but many do. Like I haven't had a flu vaccine in a long time because the last time I took it, I was sick for 2 weeks. But it did not prevent me from getting this vaccine because I realized the difference in severity. It was not just going to be some chills and some body aches. This thing is a lot more powerful than any flu that I've experienced in my lifetime, except for, Hong Kong took a lot of people out and bird flu killed a lot of people. But this thing has a different feel to it. And its impact has been different, especially in the United States. And I wonder if just this intense interest that I have never seen in the flu vaccine at all is social media, the news, the fact that it's very present, that it was part of our daily life when it was developing. Do you think that has anything to do with people's fear of it? Just because they seem more interested in it now?
I mean, I think the main thing is that the COVID has been so much more deadlier, and so a lot of people are interested and motivated in it. I haven't really seen as much long-term effects from the flu vaccine.
Yeah.
One of I call it the silver linings of the pandemic is that, thank goodness, we did not see what the doctors were calling the twin-demic of people dying from flu and COVID. But to be honest with you, there are a ton of other viruses, and we did not see a particular virus that we see in kids. And so one of the silver linings is a lot of prevented deaths from other illnesses, in part because, not so much because of the COVID vaccine itself, but because of the social distancing, the hand hygiene, and wearing masks, because some of these other viruses are transmitted in those ways. So a lot more people's lives were saved, honestly, than most probably even know.
Yeah.
I think that's why I just did the math. If I catch COVID, I don't know what the outcome is going to be. The side effects of the vaccine, you can get it either way. So it's just, you got to go play the odds. I hate to say it like that, but
yeah, I would rather suffer through the side effects of the COVID vaccine than you don't want to see what I've seen in the hospital kind of thing. Like it could be traumatic if you did, and kind of images that you see on TV, but and it's hard to explain that to people because people who are healthy or not healthy don't think that they're immune to COVID or devastating disease, and so they're like, oh, why should I bother? And they don't understand the implications once you actually get the disease, and the regret in the eyes of the faces of the people that I see, for example, that maybe if they hadn't gone to a party, maybe if they hadn't done something such and such, and the stories that you continue to hear kind of nationwide when we have these surges of regrets that people had of doing something that they knew better not to do. So, yeah.
I think perhaps, Pastor Nick, our exposure to people who we've had to counsel during an illness or afterwards probably has given us a different perspective than people who have not personally experienced it.
Yeah.
I mean, I heard strong people of faith say they asked the Lord to kill them. That's how sick they were. Literally, I don't want to go on anymore. And to hear strong people say that, I knew that this thing was really serious, and it was, and perhaps people haven't had that exposure. Perhaps it's still like watching a war from a distance, and not really being impacted by being there. But I'm not sure. Well, America has this kind of spectator sport type of thing going on, that they know how to coach a game that they've never played. So it's so there are a lot of opinions about this thing, from it's not real to it's just a case of a bad case of the flu, because they just don't know what it's like.
Yeah.
I wonder, and Dr. Howe, I think you probably would know more precisely, but I believe that when we were talking about like long-term effects, and that from the flu vaccine, I believe that when there have been kind of long-term or maybe severe side effects, I think they usually come up pretty quickly. So that may be, I mean, this is a different type of vaccine, this mRNA vaccine. So it's different than the usual flu vaccine, which may be safer, may not do that same sort of response, but at least historically, the findings come up sooner. I think what was it like 6-8 weeks maybe, with some of the severe consequences.
Okay. Wow. So we have another one. How long does the vaccine stay in your body? So some have asked, or is this something we have to do like the flu shot every year? Is it FDA approved?
So the FDA, and as far as the COVID vaccines, they call it emergency use authorization, which means like we're in a crisis, we're in a COVID pandemic, use what we have available and with everything that we know so far. And that use was produced by the FDA. As far as how long the vaccine stays in your system, I think we still have as yet to know more about that. With as we mentioned, if your immune system gets weaker, maybe the uptick will not last as long, and we just have to learn more. You know, there's been some thought that if we get more mutants or particular different kinds of mutants that predominate in the United States, are we going to have like a booster shot? So far, we don't know, but that's been kind of the speculation, because as you learn more about what kind of variants are there, then, and if the current vaccines that we're given don't have as much protection, then we might need to have a different shot.
Okay. Cool.
What about the it feels like we're seeing the vaccines distribution be accelerated, which is great. We already hit the president's 100-day 100 million injections. He's saying it's going to be 200 million. Can you talk a little bit about, I saw a question about herd immunity, and at what point do we say, okay, we're good? Not that we ever go back to what we were, but can you talk a little bit about herd immunity for us and our people?
Yeah, it's basically when you reach a standpoint that enough people have had the infection either naturally or through or by vaccine, that enough other people can be protected. And so there's different estimates as to how much you need to achieve that. And one country in the world kind of tried to do that, and they basically crashed and burned, and that didn't work. They were just trying to catch the disease. And so right now, at the rate we're going, I don't believe we will unfortunately catch herd immunity and be done, which is why there continues to be emphasis on the old school measures that we have been talking about tonight, as well as the vaccine uptake. And
wow.
I remember talking to my husband when President Biden said 100 million. I was like, is he crazy? Like, I was just like, oh, no way. But, it's really with each of these shots that and different milestones, it motivates everybody, right? It motivates industry. It motivates the community centers and the vaccination centers. Let's go. And it's, you got to shoot for higher. Why not? Because you're going to just save more lives.
Right.
Sure. I'm going to bring. Oh, sorry, go Dr. Lopez.
Oh, it's okay.
No, sorry.
No. So that, you have to think that herd immunity, that's how our vaccines have been keeping people safe, right? Not everybody has had measles. Not everybody's been vaccinated from measles. And that's why we have outbursts, because every once in a while you get a clump of people that have not been vaccinated. But it probably is a lot of people to get vaccinated or to have natural immunity, so it might be 4 out of 5.
Wow. Okay.
Yeah.
I'll try to summarize this question in one. This person asked, how does the vaccines affect persons with a history of DVT, deep vein thrombosis? What should there be concerns? We got one about individual with Crohn's disease and a few other diseases. So that's why I didn't want to pull every single question, but can you talk about those individuals who have diseases like these, and taking the vaccine?
Yeah, sure. So, I guess if somebody had a history of Crohn's disease and their immune system is weak because of the medicines they have to take, then you are susceptible to COVID. So you really should be a candidate for the COVID vaccine. But if you're on certain medicines, of course, talk to your doctor that's helping to take care of you for the Crohn's disease. As far as clots, there was some news related to one of the vaccines that we don't have in the States yet. That's the AstraZeneca. And what they ultimately ended up finding was that there wasn't enough clots to count as related to this vaccine. And so after they reviewed everything a little bit deeper, they were able to go ahead with release of the vaccine in Europe. So I would say that if you have had a history of clots, that doesn't, you can take the vaccines that we offered.
Okay. We had another person asked, they're due for their shot within, I think, this Saturday, but they have to push it back a few weeks. Extending the time between the first shot and the second shot, is that a bad thing, or is that month time frame the perfect time between the first and second shot?
Well, I think in the United States, because of the distribution issues, that ideally the vaccine should be given as prescribed, that if they say, within a month or whatnot, there have been different moments in time that because of supply, we've learned over time that actually, not recommended, but if by necessity it was pushed out a certain window, then it was okay. And what they're studying now is kind of different things related to this. And I think part of it is just because of the way the vaccine has been distributed, and given that sometimes, there's natural disasters, that happened in the South. And so clinics had to be closed and shots had to be moved for later, for example. So but it would still be recommended nevertheless, even if you had to take it later.
Okay. Great. Somebody's
The children, what can you talk a little bit about the children? We hear kids going back to school. Certainly teachers have been vaccinated, but the kids going back to schools, I would imagine, just from a scientific standpoint, that they can be carriers, maybe not have the same effect that it's had on, some people that are older than them, adults, young adults and the like. How does the science work as it relates to children and the disease and them going back to school, or do we not know yet?
I know, lucky stars, I guess. I mean, I don't have children, but I would tell you that I freak out when I hear about my friends' children, my brother's children, and just like, because what if there's slippage of mask wear and so forth? But I think the reality is that most children have been safe when they've returned to schools. Probably because by now everybody knows what to do. You've all been educated, and you see the very, very tiny little kids with, fashion masks and, exercises to wash our hands. They could be carriers, but, I think as more schools open, I think time will tell. But for the most part, from what I've seen, I think that they've been less likely to have really severe disease. Insofar as, and some schools, for example, have been open like during this whole time. But it's definitely something to kind of keep an eye on. Dr. Lopez, I don't know if you could add anything else. I primarily kind of take care of adults.
Yeah, we're both adult doctors, but I think, but I agree absolutely that, there's like anything, there's a lot we know, there's a lot we don't know. And in taking care of children, I mean, they're our most precious. One of the blessings does appear that if they have an illness, it is not as severe, but it's not 100%. But I have really been impressed. I go for walks, and you see people wearing masks, but you also see little ones, and they've got their little mask on. So I think Dr. House' point that we kind of have a rhythm to this is how we're living our lives is probably making a difference.
Kind of some people are asking a lot of the same questions, and some of the questions that some of you are asking, we've answered in the beginning of the panel. Go back and watch from the beginning, and your question will be answered. Now, this is something that Dr. Lopez shocked me with when we talked a few days ago. Do we take Tylenol before the second shot as a precaution? Now, you said something different when I asked the question about taking something before or after the shot.
Yeah, and I think we both were sort of commenting not to preemptively take something. Again, you've got your immune response that's working. But certainly if you have symptoms, you feel headachy, you feel achy, take care of yourself. Take care of yourself. Dr. Howe, did you want to add?
Yeah, so you don't want to take a kind of what we call prophylactic kind of, you just kind of, if the symptoms occur and they're really bothersome, then you could take some medication to, so that you're not as achy. I will say one caveat is that some people, for example, certain pain medicines have a component that has Tylenol in it because they have chronic pain, and that's your usual medicine. In that particular instance, because let's say you take it around the clock or whatever it is, then in that case, you would continue to take it because that's part of your pain control medicine. And so it's not per se because of the shot, but it's because of your regimen. That's probably the only exception I can think of.
Okay. Yeah, I think you said let your body do its work.
Right.
Only take something if you absolutely necessarily have to. Some people they're blaming the death of a person due to the shot, but scientifically we're shown they either had COVID before the shot, correct? And the whole thing, like especially in Britain with the blood clots in about 7 people where they stopped the Astro one. Could you guys talk about that? Like kind of dispel some of the myths. To me, the internet is great, but it's a horrible place to get your information from. Because people post things and people believe anything that somebody posts without them doing the research. And that's why we have people that believe that the earth is still flat. But I'd love for you guys to, to share your thoughts on that, please. Sorry.
Yeah. So with the AstraZeneca, basically, essentially what they found out was that the clots weren't directly related to the vaccine and weren't higher than you would expect for anything else. And so they reviewed the data in closer detail and were able to go ahead and approve it. And when people are dying, usually it's because they had exposure to COVID at some point before, and then died of COVID, the disease. I did read of one clinical trial where there are people that received the COVID vaccine, and then there's also people that receive the placebo, meaning not the vaccine, but just something that is. And the person that received the placebo didn't make it. And so we have to kind of always continually look at the reasons why people are dying, and that's why they have things like vaccine kind of check-ins and so forth, and all of that.
A lot of great information. It looks like the folks are really really been blessed by all the information you all are giving. Anything that we haven't talked about that either you, Doctor? Yeah, you're back, Bishop. You're back.
Everyone's back.
You're both back. Anything,
looks
Dr.
like we played musical chairs.
She'll get it. The wizard is behind the scenes. She'll get it right. There, see, I told you he's behind the scenes.
That's fine where I was.
Yeah, me too.
Is there anything, Dr. Howard, Dr. Lopez, that we didn't ask that you say you should have asked us about this, or we should have asked about that?
I mean, one thing I just wanted to say is that there are just very generous and kind people out there. When you navigate these different sites where you have to kind of get onto the computer and then kind of go find the vaccine and set up, it can be very it's not friendly to people who are not in the digital age of computers and phones and so forth. Like even for people who grew up in this age or are familiar, I heard of a doctor getting up at 5 a.m. to lay out all their digital things, their phones, their computers, to try to find a vaccine for their loved one. And it reminds me of the generosity of people, teenagers, adults who have been compiling sites to make it easier, or to try to find and help get people registered to get the vaccine. And I know of an ICU nurse who helps people in her spare time because she wants to, and it really reminds me of the generosity and the spirit of kind people in this world still to this day. So just if you're having trouble finding a vaccine, there are helpers out there, basically.
Yeah. Dr. Ho, we got one of your former patients is on saying hello to you.
Oh, that's great.
Saying you're such a great doctor. He's one of our members here.
Thank you.
You helped him out a few years ago.
Oh, thank you.
That's great.
One question came up was, I believe the term is endemic, where it's something that's going to be with us for years. It's going to turn from a pandemic to an endemic. Do we see that with COVID, where it's just going to be a part of us and it's not going to completely go away? Did any of you ever done any research about that or heard or talked about it?
I mean, I guess so. It's the unknown, right? But
Sure.
If you were to ask me my gestalt, like, what do you think, as someone who is interested in disease processes as an infection doctor, is I am concerned because we have pockets of people who aren't doing the right thing. They're not getting, not protecting other people. And so the virus is smart, as we talked about, and it just feels like it's really dragging this pandemic on longer and longer than it really should be here. And so the concern is whether the longer and longer the virus is smart and out here, whether we will continue to develop mutants and then continue to have to get different vaccines, just kind of how you get different variants of the flu each year. So that is my concern. I will say that to lift up the spirits of the people, we don't want to say that word. So, because we want to squash this pandemic like here and now as soon as possible so that more lives are saved.
Mm-hmm. And like you said earlier, that this happened before. We had this pandemic flu, and we were able to overcome.
Mm-hmm.
So, and that was without a vaccine.
Yep. Yeah.
Mm-hmm. So maybe we can pull together and do this again.
Yeah. You actually just answered the next question. Somebody asked, will there be a third vaccine for the variation? So we won't know until time goes on where we have to create another vaccine. Mm-hmm. But this is good because I just saw, in closing, I saw a video of New Zealand. They had a huge concert, no masks on, but because they have a communal mindset. Mm-hmm. I think there was one city in New Zealand where 3 people tested positive. They shut the whole city down until those 3 people were through the virus. And the CDC said it. I think it was the CDC, the World Health Organization. The United States is going to have a hard time with this because we're so into our own individual rights and we don't think communal. But hopefully we can kind of get it together here in the States. So any parting words from the doctors, Bishop, Pastor Rich, anything you want to share before we go?
I just want to thank the doctors for coming on. I think you answered a lot of questions in a very short period of time. And we just appreciate you helping us as we try to spread true information to the people that are connected to us so they can talk to those people connected to them. And perhaps we can change the conversation and get people closer to being vaccinated so this thing can kind of slow down on its spread.
Thank you so much. Really appreciate the time. Thank you.
Sure.
God bless you.
God bless you.
Thank you, everyone.
All right. Thank you all. See you guys later. Bye.